Hello everyone, and welcome to the fifth section of Chapter 11, Emergency Medications. We're going to go over nitroglycerin today. As always, this is Keith Woodmeyer with Wayne County EMS. Start out talking about nitroglycerin. The generic name for it is nitroglycerin. Trade names include nitrostat, nitrobid, nitrolingual, nitroglycerin spray. The actions include really dilates the smooth muscle of blood vessel walls. The term I want you to know here is vasodilator. And I'll write that here on the whiteboard. And it's really important that you know that term. It decreases the workload of the heart. An EMT can assist a patient in taking nitroglycerin if all the following criteria are met. Patient has signs and symptoms of chest discomfort suspected to be of cardiac origin. Patient has physician-prescribed sublingual tablets or spray. No contraindications, and specific authorization by medical direction. This will vary system by system. Some systems in Kentucky, EMTs are allowed to administer nitroglycerin to patients who do not have a written order for that. Nitroglycerin contraindications. Medical direction does not give permission. Medication is not prescribed for the patient. Patient has taken the maximum prescribed dose, usually about 3 within an hour or so. Blood pressure is below 100 millimeters of mercury systolic. Heart rate is less than 50 beats per minute or greater than 100 beats per minute, and that's pretty subjective. That'll vary system by system. Patients had a recent head injury or a recent stroke. Infants and children, and erectile dysfunction medications within the last 24 to 48 hours. Adverse effects include hypotension, tachycardia, bradycardia, headache, palpitations, and potentially thinkable episodes, which is fainting. The dosage for nitroglycerin is 1 tablet or 1 spray under the tongue, which is the route for that is known as sublingual. Dose may be repeated in 3 to 5 minutes, maximum of 3 doses. If the patient experiences no relief, patient's systolic blood pressure remains above 100 systolic, patient's heart rate remains between 50 and 100, and no other contraindications are noted. This is all relative to medical direction being okay with that, whether it's standing orders or your online medical direction. Special considerations include rechecking the patient's vital signs within 2 minutes, and reassessing the patient's degree of discomfort. Alright, let's see. When we're assisting with prescription nitroglycerin, step 1 is put in appropriate personal protective equipment, BSI, confirm that the patient has signs or symptoms of chest discomfort. Step 2 is to confirm the patient has a physician-prescribed nitroglycerin, or you have online or offline medical direction to administer it. Make sure the nitroglycerin is not expired and the patient is alert. Determine if the patient has already taken any doses. If so, find out the time of the last dose and the effects of the medication. Assess the patient's vital signs to make sure the patient's systolic blood pressure is 100 millimeters mercury or greater, and heart rate is between 50 beats per minute and 100 beats per minute. If there's no contraindication, obtain an order from medical direction, either online or offline, to assist the patient in taking medication, or if you have medical direction to do so, administering it on your own with the nitro that you may carry on the unit. Step 3, remove the oxygen from the patient. Pour 1 nitro tablet into the bottle cap. Ask the patient to lift her tongue while you place the tablet under her tongue while wearing gloves, or have the patient place the tablet under her tongue. Have the patient keep her mouth closed with the tablet under her tongue without swallowing until it dissolves and it becomes absorbed. Place the oxygen mask on the patient and check the patient's vital signs within 2 minutes. Reassess the patient's degree of discomfort. Document the patient's name, drug name, dose given, time of administration, and patient's response to the drug. If online orders were received by medical direction, document the name of the physician giving the order, and reassess every 5 minutes continuously, monitoring the patient's airway and breathing and circulation. Now, we're going to administer the spray. We're going to start out with step 1, put in appropriate PPE, confirm that the patient has signs and symptoms of chest pain and discomfort. Then step 2, we're going to confirm that the patient has physician-prescribed nitroglycerin. Sure that the patient's nitroglycerin is not expired and the patient is alert. Determine if the patient's already taken a dose, and if so, find out how long ago the dose was taken. Assess the patient's vital signs to make sure the patient's systolic blood pressure is greater than 100 systolic, and his heart rate is between 50 and 100. If there are no contraindications, obtain an order from medical direction, either online or offline, to assist the patient with the medication. Step 3, remove the oxygen from the patient. Ask the patient to lift his tongue while you spray the medication under the tongue while wearing gloves, or the patient self-administer under the tongue. Have the patient keep his mouth closed without swallowing until the drug is absorbed. One key thing to remember with this spray is to make sure to do a test spray prior to administering the medication. That way you can ensure that the sprayer is primed and the patient will get the full dosage as necessary. Replace the oxygen mask. Step 4, replace the oxygen mask on the patient. Recheck the patient's vital signs within 2 minutes. Reassess the patient's degree of discomfort. Document the patient's name, drug name, dose given, time of administration, patient's response to the drug. If an online order was received by medical direction, document the name of the physician giving the order. And reassess every 5 minutes, continuously monitoring the patient's airway and breathing. Important thing to remember, the dose for nitroglycerin is 0.4 milligrams per kilogram. I'm sorry, not per kilogram. It's 0.4 milligrams per dose. So either one tablet or one spray is 0.4 milligrams.